Ladies and gentlemen, we are in Cairo with a great personality, great doctor, Dr. ASHRAF Metwally. So, to speak about the beauty for the human being, of course, not including nature, etc., but what he's a great surgeon in English.
Yes, surgeon, yeah.
And so he received customer from everywhere in the world, from I don't have to precise the countries, but Italy means Europe, USA, Arab world, everywhere. So no question, but what you think is the concept of the beauty?
The concept of the beauty.
For men and women, of course.
Yes. We started this career since approximately 30 years.
Yes.
And we observe the progress in the concept of the beauty in our customers. In the first yes. In the first 10 years, there is no great concept or great desire for the patient to get beauty by the surgery, because they complaining from huge breasts. They want to reduce their breast, but a huge abdomen to reduce their. But after the next 10 years, we observe the great change in our clients. They want to proud by their surgery, because the surgery, the plastic surgery, becomes interfere with the daily activity in the success of the career. It also increase the self-confidence of the women and of the men. Okay, so when we observe that our clients wanted to do plastic surgery to be more successful in the community, more successful in their job, more confident in their daily life.
Not only for public figure that was before, but
no,
of course it's extended to everybody.
We observe that the surgery, the plastic surgery become interfere with the daily activity of the clients, the daily activity of the success in the career, the confidence in the society itself. Okay,
it's like a refined dress.
Yes.
So when you have to choose which dress you have to wear, you have to the aesthetic too, and I know that very important about you.
And this is a great change. This is a great change we observed in the last 10 years. Yeah.
And I know about you, of course, that you suggest also to the customer what they have to do.
Yes, some customers come to me and say to me, doctor, look, what should I do? Yes,
this is the best.
Yes. So when I hear this question, I stop little bit and look to my patient or to my clients and try to understand the circumstances
and
that
also
pushes
the personality of the client.
That pushes her or him to do this plastic surgery. When I become relaxed and become convenient for her or his request, I suggest the
job,
the career, the social class is important. There is some social classes in developing country can't be familiar with plastic surgery, so you have to choose the surgery that's suitable for every social class.
Exactly.
Yes.
This is extremely important, because the people have to continue to recognize themselves.
Yes, and to introduce themselves in the community and in their work
better
by the new way.
I think the plastic surgery is like a smile.
A smile,
you know,
yes,
because to be confident with and for the new image, but is just improving.
improve,
You know?
improve the mood,
Improve the mood,
yes, improve the
and-
output in the community and in the work.
Okay.
Yeah.
And what about the new technique about
Yes.
plastic surgery?
The development in our fields in the past, in the first 10 years, we didn't try to indulge the patient with many procedures together. But now, with the industrial development in our field, okay, myself, I didn't like the commitment into plastic surgery. I like that come to me, do a couple of procedures to reach you by the things that you want, or the visions that you want, or the shapes that you want, okay, in one session. So my
This is extremely important
Yes.
to coordinate.
To coordinate.
This is very,
and they
very
give a very
intelligent.
compliment. Yes.
And
yes. And so when patient come to me to do facelift, I didn't like facelift alone. I like facelift with blepharoplasty with hand rejuvenation,
Oh.
because you didn't look by juvenile face and aging
the
hand. Yes.
no, this is
So it is, the hand is very, very complementary procedure for the facelift.
of course,
Yes.
definitely.
Yes,
the hand are the
yeah.
first, you
The
know,
first.
look.
So you
to-
must do a couple or a conjoint procedure for one patient to reach the
Harmony.
desired and the beautiful look, the complete beautiful look. So one procedure now, it is not an accepted style for surgeries.
Absolutely.
Yeah, and I didn't like the commitment in plastic surgery. You have to go once in every 10 years for your doctor.
Yes,
This is my
definitely,
philosophy, yeah.
Yes, of
This
course.
is my
to,
philosophy,
to
yes.
maintain,
To maintain, yes.
to maintain like a diet, for
Yes,
example,
yes,
to
but-
eat regularly,
yes.
to maintain the health,
To
because
maintain the health and
beauty
everything,
is a
yeah.
part of the health.
It is, and need maintenance, but our skills must be served to decrease the commitment, because you have your job, you have your time, you have your family, you have your work. So the commitment, it is not an acceptable way in my philosophy in plastic surgery after
course.
30 years of experience.
Oh yes, because I know that many customers love you,
Yeah,
definitely,
yeah,
for your technique, your ability, and your concept,
Your
and
concept.
your aesthetic.
Yeah.
So what, there is some new procedure in surgery that you could recommend, that
Yes.
you made already?
Yes, in the past, in the facelift, as an example, we use the old-fashioned technique in the neck lift. So the face must have a neck lift, okay? In the older procedure, we make a complete surgical dissection of the neck to elevate the platysma muscle and cut the skin and something like that. But now, with the progress in the industry and the invention in our field, there is the J-plasma technique. J-plasma technique minimizes our intervention in the neck. So it shortens the time of the operation, improves the quality of the skin, okay, minimize the skin tucking of the neck, and also decrease the time to return work. And also you can do the operation without drains. The drains is a very, very annoying
Oh yes.
for the
Yes,
patient.
okay.
So with J-plasma in the neck lift, with the face lift, minimize everything for the patient. Increase or accelerate its return to work. No drains. So you remove a very, very heavy load from the patient by the
Definitely,
Yes.
definitely. And plasma is a substance that...
No, not plasma.
what
No,
is
it is a J plasma. It is a laser.
Ah, it's
It is a laser. Yes, it is a laser. Okay. It is a laser. It is an surgical procedure through a probe, but it is a telescopic. I can run it under the skin to evaporate the plasma from the skin, so shrink it, the skin over. It is an invasive procedure under the skin, invasive procedure under the skin. By the hot or the thermal effect of the J plasma, of the laser, cooled by nitrogen, okay, nitrogen gas, we can shrink the tissue through the evaporation of plasma. So if you have 2 centimeters skin and do J plasma for this 2 centimeter redundancy, it become half centimeter without skin tucking. Without skin
This is
tucking, yes.
definitely great.
Yes. Yes.
And is parasurgical because
Parasurgical, yes.
is
We
not
call it
exactly
as neck
surgical.
lift assisted J plasma. Yes.
So this is a big
Very nice.
advantage for
Yes.
the client.
And you can do
because-
it, at any part of the body.
Yes.
In the arm, okay, in the tummy, in the abdomen, the thighs.
Exactly.
Yes, exactly.
So fantastic. So il dottor Ashraf Metwally has a studio in Cairo, Mahadi. You can find him, of course, in internet.
Yes,
in the website.
drashrafmetwally.com.
Exactly.
And on
so-
Instagram, Dr. Ashraf Metwally.
Exactly. What I had to so there is also to help the surgery. There is also fillers or Botox or other procedure.
Yes. Filler and Botox. Botox is a marvelous drug, and you have to do Botox. And forget your name and don't forget your Botox.
Yeah, okay,
As
yes,
this is.
yes.
But I have a special opinion in fillers. The filler is an old school.
Ah, old school,
Old
eh?
school, yes. It is in plastic surgery, okay? It starts as
So I'm not too much
1996. No, it is a
recommend- no.
static type
No.
of treatment. Static type. I fill the biological tissue by dead material. So it is not acceptable in the experienced surgeons now.
This
And
is
it's
very,
by
very
experienced
important,
surgeon,
eh?
yeah. But we shift to the biological treatment.
Yes.
Yes, biological treatment is
More
very easy and more
natural.
natural fat transfer. You can transfer fat at everywhere in the body. So it is biological live cells. Live cells and biological, and it can rejuvenate your skin and by improving the function.
Improving the
fun-
function to
yes.
help the
Yeah.
body.
Yeah, to help the body to regain
Naturally,
its
no?
juvenile look. And the fat transfer now, it is highly progressed and highly developed by the instrument, by the way to harvest the fat, by the way to inject the fat, and by the addition to use to increase the survival rate of the cells by what is called PRP, or plasma rich platelet. You can take the thrombocytes or the collagen forming cells from your blood and inject it with the fat to increase the survival rate. So we didn't see the patient that underwent fat transfer in the face at, for example, except after 6 years.
Oh yes.
Yeah.
And what about the elastin and collagen? Also, somebody take it by capsules.
It is very nice treatment. It is try to encourage the biological and provoke the cells to produce more collagen and improve the function. Is very nice. But only I object on the hyaluronic acid injection in the face for everyone. We have to choose the client.
Oh yes.
But fat is recommended for everyone.
Everyone.
Hyaluronic acid not recommended for everyone.
Exactly. So, Dr. Ashraf, of course, present himself by himself. So, sure, I think you enjoy a lot for this interview, and so is a real concept of beauty. So, beauty is health, is aesthetic, of course, because you look at a flower, so you like a flower.
Yes.
So the beauty is
I
that
see many people who change their life by the surgeries, change their career, accepted in careers that are repelled from it in the past.
Exactly.
Yeah, I see many success of cases.
Exactly, because we help ourselves. And the consequence that the people is happy to see our smile, you know, our and
our vitality, our
vitality, energy,
energy, yes,
okay.
Yeah.
So thank you so much,
Anytime.
Dr. Ashraf
Anytime, Mr.
Metwally.
Federico.
Thank you so
I'm
much.
very happy to meet you.
And
Yes.
me too.
Yeah.
And we will proceed with another interesting interview as soon as possible.
Inshallah.
Okay?
Okay.
Inshallah. Kulli sana wa antum taybin. Thank you so much for your kind attention. Bye.